in contact with patients' blood, body fluids, or secretions, in keeping with prevailing hospital protocols. I also remind our health staff to ensure proper disposal of hospital waste and urge to wash your hospital laundry thoroughly. Boost your immunity by taking vitamins and monitor yourselves for any signs and symptoms. Your health and safety is of paramount concern to the department, he concluded. So that was the prepared statement of the Central Office, Department of Health. So we will have a short statement from R.D. Bernadas.
Maayong hapon sa atong tanan. Now, the department is closely monitoring the different activities that we have conducted, intensifying our linkages with local government units and other national agencies in the pursuit of implementing intensified surveillance activities and following up of referrals from different agencies in consultation with our field personnel, especially the Bureau of Quarantine, our local government units in the Tri-Cities, especially in our port of entries, airports, and ports of the airports of Cebu and Bohol, and in coordination with our city health offices of the different cities and provinces, the provincial health office. Our local government units has also organized and intensified their command system and putting in place surveillance measures and response response teams. So the department is now currently closely monitoring developments in as much as the information is fluid and continuously changing every day. And therefore, the department, through the Secretary of Health, has scheduled a release of information every 1 o'clock in the afternoon, and thus would be followed by the regional offices concerned after such pronouncements. So this schedule would be done after the 1 o'clock schedule of the Secretary. So we are now meeting here with you for some clarifications or some information that would assist the public and our communities to be informed and do necessary things that can be done to minimize or to avoid the increasing or the transmission of the new or novel coronavirus in Region 7.
Thank you, RD. And also a few statements from Dr. Terence Bermejo from the Bureau of Quarantine.
Good afternoon, everybody. We at the Bureau of Quarantine also have been coordinating with the various stakeholders, especially at the airport, the airline companies, the ground staff, the ground handling crew, the Office of the Transportation Security, and immigration and the customs at the airport. I've been also attending all the coordination meetings with the governor yesterday and also this morning with Mayor Labella. And I am just happy that the mayor offered some assistance also to the Bureau of Quarantine as they are in a state of preparedness as being declared by the mayor himself. So what's new at the Bureau of Quarantine now at the airport, what we're doing at the airport? So we've started distributing our health declaration checklist. We started distributing on Monday. So these checklists were loaded into those Chinese airlines for that for the passengers on that flight arriving in Cebu particularly to fill out those health declaration forms so that that forms may be useful later on in the event of contact tracing, if in any event that there would be a person under investigation. At the same time, we're also distributing a health alert notice to the passengers upon arrival at the airport. This health alert notice will notify the passenger, will inform the passenger really that to inform their local health unit here in Cebu, especially like if they develop symptoms related to the novel coronavirus or they develop cough or fever, so that they may also contact the Department of Health. So let's assure you that we at the airport are on vigilant right now and on heightened alert.
Thank you, Dr. Enz, for that statement. So the floor is now open for questions. If you would be asking a question, kindly state your name and the news agency that you are representing. Yes? Mike?
Good afternoon, Dr. Nadas. James Agustin, GMA7, Manila po. We have information po from Dumaguete Provincial Health Office na they have already located some po yung mga hotels and mga establishments. Ano pong balak ng DOH Region 7 at ilan na po itong pinag-uusapan natin na contact trace ng DOH po?
Now, we have been in communication with the Provincial Health Office of Negros Oriental. Personally, I was there yesterday. We met the governor, we met the team, and the organized incident command structure of the province. Unfortunately, yesterday also broke the news that a patient turned positive for the new novel coronavirus in a hospitalized patient in Manila. Now, the travel that was mentioned yesterday, that the patient has been in Cebu and in Dumaguete, has been confirmed. But corrections shall be made that the patients or the couple, because they were a couple, did not come to the city. The couple only stayed in the airport and directly went to Dumaguete in the afternoon. So that was a 3-hour stay in the airport.
Yeah, 3 hours stay.
And they went directly to Dumaguete. And the places of stay in Dumaguete has been identified. The Provincial Health Office, together with the surveillance team, has located them, start enumerating the possible contacts of these patients. And our team has left also this morning going to Dumaguete to assist the local health workers there. A team also from Manila, I think, has arrived now in Dumaguete to assist the activities there. Your questions regarding how many, please wait for some developments. I cannot give you the number now, but rest assured they are enumerating them efficiently as to who were the possible contacts of the patients in Dumaguete.
Doc, ano pong mga establishments yung pinuntahan sa Dumaguete?
Please bear with us. The hotel and resorts owner has requested us to withhold their resorts and their hotels.
Pero at least estimation lang po, how many na po yung nakausap natin na direct na nakasalamuha po nitong Chinese?
As I said, they have gone there early noon time today. We will be awaiting for their reports. Wala pa tayong specifics.
Pero nakausap na po personally, Doc?
They have already started and they are there now in the area.
Naka-isolate po ba sila, Doc?
The protocols are there for them to follow as to who will be quarantined at home and who will be referred to a higher facility. It's up for them to use that protocol, and we will receive and give you details as soon as it comes.
Apo. Doc, tapusin ko lang po lahat ng questions. Dito po sa Cebu, 3 hours, nag-ano lang po siya sa airport. Ano po yung tinitingnan po natin ng mga nakasalamuhan niya sa airport mismo, dito sa Mactan, Cebu?
Okay, I'll give you our BOQ, Dr. Terence.
Okay, I've been in contact with Mr. John Binamira of the GMR Megawide Airport Corporation, and he's doing that right now. We don't have any control at the domestic airport. We are usually mostly at the international airport. But what we're doing right now is do contact tracing for those passengers that were seated beside those couple. So they're busy right now. Actually, we have identified those who were seated, and then we're just rummaging in front of immigration their arrival cards so that we may have to track their address and do the necessary protocol afterwards. Yeah. I haven't had any information regarding that yet, so I'll just be monitoring on the developments as the day towards the day.
Thank you, Justine. Dale from CNN.
Yeah.
What kind of, can you describe to us the people na the couple were able to contact with or have contact with? Are they immigration people, or are they the ones just in the restaurant at the airport? Or what were they doing at the airport, sir, for 3 hours, sir?
That I don't have information regarding that one, because after they left Terminal 2, they went directly to Terminal 1, which is a domestic airport. So they took their flight there to DUMAGUETE.
So they took a bus, sir, from the airport bus from Terminal 2?
That I don't have that information as well. Yeah.
Sir, the young tapad, sir, the ones beside him or her, or the couple at the plane, are they also foreigners, or are they also
I'm not at the
Filipinos,
liberty to divulge that information for now. Yeah.
But are they from Cebu, sir?
No, I cannot say. Yeah. I'm sorry.
How about the flight attendants, sir? Are they also being monitored?
That we're also talking to the airline themselves. We have already spoke with the airlines last night.
All of the flight attendants on the 2 planes, sir?
Yeah.
All the contacts will be subject to the investigation and possible validation of all the information that would lead to possible actions. So that would be dependent upon the reports of the initial investigation.
RD, do we have an estimate of how many people are we monitoring?
That we cannot give you yet now because we still have to receive the reports. It's an ongoing thing.
It could be 20 or lower. Or...
Please don't give me a number.
RD, dili ba ta maglisod sa
name
pag
and-
RV Veloso from DOH-7 and Super Balita. RD, dili ba ta maglisod sa pag-trace sa katong mga tapad sa couple?
Now we have protocols to follow. We have sources of that information. The difficulty, yes, it is difficult, but we will try all means possible to really do what can be done in tracing all those individuals so that we could do the appropriate measures to contain possible transmission.
Good afternoon, RD, Doc. Nico Sereno, GMA7 Cebu. RD, what will happen once we identify these persons? Katong tapat nila sa plane, those they came in contact with, will we require them to report to DOH?
Three things. First, if they are found to be asymptomatic, they will just be advised to stay at home or stay in their hotels, and at least for 14 days. Now, if they have displayed some symptoms, they will be referred to a facility, worked up for some diagnostic tests, and then if they are manifesting signs and symptoms of respiratory disease, they will be referred to a hospital wherein they could be admitted and isolated.
So this will be mandatory, RD, sa ilaha?
As what was mentioned by the Secretary, all these are voluntary in nature, but it depends on the situation. If ever we will apply the law about the quarantine law, So if it really endangers the rest of us, then the quarantine law applies.
RD follow-up. If mag-quarantine, self-quarantine sila, RD, na ay mo follow-up nila? Kung kinsa?
Of course, yes. That would be our duty, the duty of our RESU and the duty of our surveillance officers on the ground, mga partners nato sa local government units.
Lorraine Karma from the Freeman. RDS, for the establishments that we have identified where the couple has stayed in Dumaguete, what course of action will we take to ensure the safety of the people staying there, or the disinfection, has it begun already?
Just the same. Identification is number one, and then classification of those persons with contacts. The same 1, 2, 3 that I have said. And then, of course, the staff of the resorts or the hotel will also be part of that. The same protocol will be followed. So that will be the same approach is applied, whether the patient, the hotel personnel, or the community itself. So tatlo pa rin ang gagawin: home quarantine, hospital isolation, and admission.
Director John Arua of PTV. I would just like to clarify how many persons under investigation of PUIs are we right now do we have here in Central Visayas, and how many establishments in Dumaguete that we are monitoring because of this case?
Number one, we give you the number, Van, the actual inventory for now. We'll give you the report now, the actual number. But the mention of actual persons of investigation, dalawa lang for Region 7. The first one has already been released as negative, so they are already discharged. About your question about establishments, we don't have for now in Cebu. In Dumaguete, yes, those that were identified as the places of abode when they were in Dumaguete. But again, please withhold the name because that was the request of the owner of the hotel and the resort.
How many establishments po daw are they sa Dumaguete po?
That we still have to verify. Wala pang actual verifiable information.
Okay, follow up lang po, RD, kasi yung PRESCON kanina sa National DOH, dumating po yung dalawa po dito sa Cebu, January 21 from Hong Kong. Tapos umalis po from Cebu to Dumaguete, January 22 po.
21.
That's the one that we were correcting earlier. The couple arrived 21 on the morning or noontime. Noontime. And left for Dumaguete the same day, 4 o'clock in the afternoon?
5 o'clock.
5 o'clock in the afternoon.
Regarding po sa statement ni Governor Gwen na i-quarantine po yung mga Chinese from China na pupunta dito sa Cebu, or tourists or passengers from China, ano po yung is it mandatory quarantine po or sa bahay lang po?
That is the subject of the technical working group meeting at 4 o'clock today. So that would be a meeting that would determine the guidelines and processes to implement the announcement of the governor. The governor has explicitly said that the EO, if ever issued, will be effective February 5. So from now to February 5, we will be drafting the guidelines and the protocols to implement her order.
RD, good afternoon. Carmel Matos of Radyo Pilipinas. RD, I'd like to ask, the epidemiology team that will be arriving in Dumaguete City, what will they be doing there, RD? Mga procedures na ilang ipahigayon dito sa Mount Lungsod?
These are technical procedures, but more or less for your general guidance, they will be looking into places, persons, and consequences and situations. So they will be correlating that with protocols and the known information about the virus, and they will be giving us the conclusions and results of the investigation based on actual situation. They can do that. The complete contact tracing. It depends on the availability of the persons identified. For the places, they can do that immediately, but for the persons identified, it depends on how long they could really identify the whereabouts of these people.
Okay, can we limit to 3 more questions? RD Bernales has a meeting again with Governor Gwen.
Doc, regarding naghihapon sa katong plan ni Governor Gwen ngay quarantine for 14 days, I understand nga some of the airlines ang ni-cancel na sa ilang mga flights from China, Macau, Hong Kong. But considering pod RD nga sa number of kanang passengers nga mo biyahe pa dong dire sa Cebu, maato ba ni nato sa tong mga facilities unya, for example sobra gyud na 100 nga tulo ra ka facilities pa ang gi-identify nga for 14 days, so more than 1,000 gyud na ang ma-quarantine if moabot ni sila dire sa Cebu. So maato ka na
As I said,
pila ka facilities.
As I said, there were levels of quarantine that were identified. One of those would be house, homes, or hotels. There will be closely follow up there. It depends on the situation or the actual identification of these travelers or tourists. Now, depending on the guidelines that we will be finalizing today, there will be degrees of isolation, diba? Pag may signs and symptoms, they will be put in the hospital. Pag walang signs and symptoms, they will be in a facility or in a hotel or in the house or in the homes. That we will try to assess as it comes because we will have no choice.
Aiza Layage from ABS-CBN. Director, I would like to ask if how protected are the personnel who's going to handle for those passengers who are going to be quarantined, and then if pila ka teams or ato karon as of now, pila ka teams ang ni-handle currently for those tao or mag-add pa bata?
That's the most important announcement of the Secretary. For protective equipment and devices, paramount is the health worker. The health worker are the ones in close contact with possible infected patients, so they will be the most protected. So we are ready. Our health personnel should be using protective equipment and devices when they face suspected patients and suspected corona patients. So it depends on where they would be going. For now, we have teams that has been created on standby. They are on 24/7 on call if ever there will be situations that will call for it. Our hospitals have been activated. We have designated isolation rooms. We have prepared for surge capacity situations wherein we need more rooms. We have identified also in our hospitals possible areas where we could accommodate patients and suspects or facility quarantine personnel.
Katong teams, ang existing nato nga team nga ni handle or trained ani doc, mga pila ni sila ka personnel?
Muna karon akong ingon nimo, there are for now standby 3 teams, but we could expand easily to how much do we need? How many do we need?
3 teams is composed of pila na siya pa?
3, 4, or 5.
How about atong mga local like RHUs nato, doc? Are they also prepared? I mean, facilities-wise, personnel-wise?
Our RHUs has been given the advisory how to handle situations. If there are consultations, they will be directly calling our attention through the RESO. Then the RESO handles the information, and then the RESO transports these individuals if necessary. So if it does not need hospitalization, they will stay in the respective places for observation in the homes or in the hotel or in the where they are.
How about sa hotels? Kay the other night, for night case sa Lapu-Lapu nga nag-show og like fever lang 37, tapos instead of handling it like ipa-check lang, gidiretso nila dala sa Soto and then gigrab lang nila. Have we talked with or nag-meet with
I think the information is not perfect. There were I heard about the information, but I need to verify what you have stated now. I cannot confirm or deny that, but later I will check the details, what happened to that individual.
Any advice, especially sa
We have issued an advisory to our partners, especially hotel and resorts owner, to report directly to our RESO, so that the RESO, our RESO, can advise in particular what may be done.
Okay, thank you. Last question.
Last question, RD, Juanilin Sabalo from Sunstar Cebu. Although not all people are really advised to wear a surgical mask, only those immunocompromised, there's a lot of posts in social media saying what's the correct way of wearing it. May we hear from the DOH, RD, kung unsa gud ang proper nga way of wearing the surgical mask, the blue face or white?
Okay, do you have a mask there? If you look at a surgical face mask, you have a colored and a white side. Okay. The white side is the absorbent part.
Okay.
The blue part is the plastic or rubber side. So it's not absorbent. Diba? So if you look at that, you use the absorbent part to the face, to the side of your mouth. So the blue part, which is water resistant or how you call that, water repellent, mo na sa gawas. So that, yun na. And then if need be, you put a lining of tissue paper beneath it, beneath the mask. And then you change the tissue paper frequently. So if you are using your mask, using that 24 hours, you're putting more risk in yourself than the open air itself. So if you're using that mask the whole day, you'll be putting more risk for yourself. So you put your tissue paper there, and they change the tissue paper very frequently. 30 minutes, 15 minutes, it depends on the way you talk. We are not recommending that you use your mask, because the mode of transmission, as I said, is droplet airborne. It needs direct contact to a sneezing and coughing carrier or patient. So it does not float in the air.
But your advice lang RD to the people, because some people already scam.
That's why I was really repeating this over and over again. We are not recommending that you all wear masks. You only wear your mask if you have, you'll be traveling in places that you are not certain that people are coughing. But in your daily course, you can do it in open air.
Last question.
If you have nothing to do, you stay at home. Do not go anywhere. Okay. If you do not have anything to do, you stay at home. Rather, if you have important things to do, you try to plan your travel. If you want to go to an office, of course, you know the road going to your office. You can determine asa ka pwede mo adto o asa ka safer mo adto. Diba? So, if you have nothing to do, you stay at home.
Okay, so I think RD has to leave for the meeting with Governor Gwen. So, short statements lang before you go, RD.
Again, let us all be vigilant. We are all in this together. You try to do what is appropriate for our individual mandate to do. Diba? Kung nata sa press, you try to inform the people, provide them the correct information. Please shy away from social media. If you want to have some valuable information, you go to our website, the nCoV 2019, DOH.gov.ph. That will be updated every day, every 1 o'clock. Then for the regional website, you go to ro7.doh.gov.ph. Please, shy away from the misinformation and the malinformation that is being propagated in social media. Thank you.
Thank you, RD.
Thank you.
Thank you, Dr. Renz. So, thank you to our media friends for coming.